are at workshop 1, and we're already a quarter of the way through it. So I'm very happy for the introductions, and again, happy to see you all. Today I want to talk to you a little bit about sort of introductory ideas and the basis for the approach we're going to take. A little bit about theory, because I believe that, things that are that have been well researched that can help sort of, drive best practices and how you develop effective communication campaigns. And then I want to talk a little bit about formative evaluation. So today is a little bit heavy on sort of a little bit more lecture material, and as we move forward, we'll sort of have a back and forth with you doing homework in between, and then us using that as a basis for the next workshop. But I just want to make sure that we're all starting on solid footing as we move forward, and so that is my intent today. And I'll start there. So originally, the sort of tentative schedule is a series of what we're envisioning as 6 workshops over the next, probably 6 months. And we will be working through the various parts of social marketing, which I'll describe again in a little bit. But we're going to start today again with those topics. I'm going to have you do some homework where you review the data and information that you have about your particular problems in communities. Then we're going to spend a couple weeks more on the communication elements of thinking about best practices and ways to effectively communicate your ideas and goals and objectives to your community to actually help make changes in some way. And then we're going to talk a bit about, and during that period, you'll be developing different potential perspectives of how you might actually approach your problem with material development and so forth. Then we'll be talking some about implementation, and then we'll have you sort of test your ideas a little bit with your community, and then we'll have you come back and share where you are with the materials at that point and talk about evaluation practices. So that's kind of the brief overview. And again, I'm happy to take feedback anywhere along the way, and we can change direction as we go. The workshops are not your only opportunity to interact with us, and I do want to tell you that I am available in between for phone calls, emails, Zoom meetings, whatever, to help clarify things for you and make sure that you are on track with developing good things. The other thing I do want to be clear about, and I had a conversation with Anna Helena about this about a month ago, is that the world has really changed in the last month, in the last few months. So if what you need to do or want to do for your goals and objectives look a little different than what maybe they did in February, that is perfectly understandable. And we are still committed to working with you all because we want something practical and usable to come out of this. And that amount now, again, might look different than it would have if we had done this project pre-COVID and national shutdowns. So I'm a health communication communication scholar, and I have no degrees in the health sciences, which I didn't say at the outside of this, although I've said it in previous webinars that I have done. But I approach things and I lead with a communication approach, which is really based on truly understanding your audience and the individuals that you are trying to impact, and doing a full audience analysis to ensure that you really have a sense of how people think about things, understand things, what matters to them, what the obstacles are they encounter, what the benefits they see of things are, etc. Equally important in this sort of marriage of these two ideas is really understanding the health problem. And this is, for the health science folks in the room and the clinical practitioners in the room, it's really understanding the nature of disease and epidemiology and prevention and who's affected and why, and what the nature is of, spread and treatment and screening and all kinds of things. And so ideally, when you approach this from a formative evaluation side, that means that you need to do both parts. You need to sort of, go deep in thinking about the health issue and analyzing it and getting people's perspectives on it, as well as, again, knowing your audience and trying to figure out who they are and what their needs might be. So what is a health campaign? So a health campaign is a purposeful attempt to inform or influence behavior ultimately. And that behavior could be at the individual level, but it could also be the behavior of policymakers, of community planners, of funding agencies, etc. So it's not always about changing individual level behaviors, like teaching people how to lose weight or why they need to be screened for colorectal cancer, or letting people know about treatment facilities, for example, that are available. And so this will be part of the issue, is thinking through what it is you really want to change and why. Health campaigns are directed at large audiences. So Annalena, I don't know if she's still on. I know she was coming and going, but as a clinical psychologist, she often thinks about treatment and so forth at the individual level. I tend to think about change more at a population level. And so health campaigns are really directed at large audiences. And what is large can vary a lot, right? So it could be your local community. It could be in your school systems. It could be in workplaces. It could be a lot of things. But it could also be, at larger levels, national, international, et cetera. They tend to be very time bound. And so we think about campaigns as being chunked out. Sometimes we have very, very long campaigns, but they tend to go through cycles and have change. So, some of the longest campaigns that have been used in the United States, some of you may know Smokey the Bear, who has been around since the 1940s in the United States. And really started about preventing forest fires, not necessarily because of the environmental impact, but originally because of the wood that would be required during the Second World War. But that is a very, very long-term campaign. But again, how it has evolved over time is kind of chunked out into smaller pieces. It's using an organized set of communication activities. So it could involve, elements of face-to-face. It could involve community events. It could involve various types of social and traditional media, etc. It's usually done, again, over multiple channels, but not necessarily. So, it all might be interpersonal. It could, be centered in a healthcare facility with more provider-patient communication, and your campaign is directed toward healthcare providers maybe delivering certain kinds of messages. But the goal is to produce a benefit to individuals and society overall. Marketing, which is closely related, is really thinking about the commercial side, which is an activity, a set of institutions and processes where we create, communicate, deliver, and exchange things. And these that have value for a customer, client, marketer, and society at large. So you can already see a little bit of level of overlap there. So the two together are often thought about as social marketing, which is basically borrowing the best principles from commercial marketers and applying them to social products and social goods. The disadvantage we have is, compared to large automobile manufacturers or Apple Computing or Zoom, we don't have, huge resources. But that does not mean to say that the parts that they pay attention to are not beneficial to you all, and so we want to think about that. The great thing about social marketing is, again, it sort of gives you a rubric or a process for thinking about what development should look like. So you do some pre-programmed data gathering and formative evaluation. You use that information to think about segments of your audience, about you want to give some thought during that stage to resources that you have in terms of thinking about how to scope your problem, because if you don't have a lot of personnel or time, it looks quite different. And or you might need to spend time building community partnerships to get other volunteers and organizations on board to partner with you to kind of increase the pie that's available. Exchange is really the idea that no matter what we ask in a marketing appeal or a social marketing appeal, people are being asked to exchange one thing for another. And it might be that we're asking people to not sit on the couch and go get physical activity. It might be that we're asking people to spend time that they would have otherwise spent, for example, with their children. I mean, there's a limited amount of time during the day. From a resource standpoint, something that costs money for something else that costs money, because individuals do not have unlimited income typically. We live in a competitive environment, and so that is a challenge. For those of you who work with tobacco treatment, for example, the wave of e-cigarettes and vaping has taken over the country, in part because our competitors, the manufacturers of those products, particularly Juul, have really ramped up the amount of money that they spend in advertising. They have since, had some federal policies that have curtailed their ability to advertise in the types of products that they sold, but in many ways that's too late to actually curb the problem. And then the communication piece is really around thinking about what's called the 4 Ps of program development, which is what's the product? What are we selling? What's the price of that product? How do we promote it best? What type of approach do we take? What kind of information do we use? And then where do we place it? Like in terms of thinking about, media or interpersonal or organizational settings. And then throughout this entire thing, we want to be constantly evaluating to make sure that what we're doing is has the best chance of being successful. And this is a big challenge often for funders to understand, because really, if you don't start with really good data and information at the beginning, and you don't take time to keep checking back with your community, for example, about the acceptability of your approach, whether or not they would pay attention, like it, etc., and then you launch something, it's far less likely to be effective. And ultimately, we want you to be as effective as possible with whatever it is you're doing. I went through that pretty quickly, and we'll be, again, chunking pieces of that out over the next 5 weeks. But does anybody have any questions at this point? All right, you're doing a good job hanging in there so far.
Will you send us these slides?
I absolutely will send the slides. And in fact, I'll send you more slides than I plan to use.
Thank you.
You're welcome.
And I am suggesting one thing.
Yes, ma'am.
I am wondering, Cindy, are you going to create a special section on the web page so you guys can communicate and upload things?
I think that is a good suggestion. Since we are recording the session now, you could also put it out for others who are not able to be a part of this, at least to see what is happening and also get a benefit from it, even if it's not their own one-to-one TA. So yes, that's a good suggestion.
I think it's a very good idea so that people can go back and access both the PowerPoints and the recording. So sorry to jump in, Shelley.
No, I asked you to jump in. I'm good with that. I also think it's good because we could also put other information
Yes.
and resources there that might help you along the way.
Mhm.
As we know more about you and your projects, I will have much more specific recommendations for what might be helpful for you all.
Yes. Yes.
So right now we're at a very 360 view, but we will be coming down to kind of make sure that what we're doing is most dead on with what it is your needs are and what your data say about, again, both the problem and the audience.
Thank you.
Yeah. All right. So I have to show things because it makes me feel better, but this is one of my favorite bits of communication that was released over the last few months for COVID. So there's an advertising agency that has been in Detroit, Michigan for 60 or 70 years. And I just want to show this because I think it's sort of an aspirational look, and we can have a little bit of discussion about it. And I'll be interested in your reactions. So, and once I can see you for a second, I'll ask some more questions, but it'll take a minute or two here.
It feels unnatural to not be in motion. For the city built on four wheels to stand still. But these vacant streets, empty stadiums are not signs of our retreat, but of our resolve. This is not us sitting out the fight. This is us winning it. Our fist doesn't need to move to have strength. If he were alive today, even Henry himself would have put it in park. So take this isolation as a sign of our togetherness. As we take care of ourselves and the ones close. Because although it's time for America's motor to stop, we're coming back with all 8 cylinders. Because here, we don't stop in the name of fear. Here, we stop in the name of love.
So I'm gonna move over a little bit so I can see people while we have a quick discussion. But what's good about that?
This is Linda talking. I'm going to jump in because if I don't, I'll just start crying. I was really moved by that. I loved the automobile references. I loved the Motown references. There were probably other references that if I was from Detroit, I would understand that I maybe didn't catch. Detroit's always struck me as a gritty kind of a town, and so the black and white really worked for me. And I loved everything about and the word all of the auto references I thought were grand. But stop in the name of love, boy. Thanks.
Others?
I like the black and white.
Mm-hmm.
Here is why I like it, because this is a time in the world and the US history that is bleak, and it's very hard to see colors and optimism. So I thought the way to sort of show what the consequences are, both in color and in emptiness, or lack of color and emptiness, I think was very powerful.
So I lived in Michigan for 5 years, and it's another home for me. And so I agreed with Linda, and that was one of the reasons that this thing is very moving, I think, because there's a sort of there's a balance between the horrificness of the situation and a sense of hope, and a strong sense of history and cultural tailoring. So the images are extremely Detroit, the nods to the specific history and people of Detroit, the grit, the importance of the auto manufacturing plant, the Fox Theater, which is home to Motown. I mean, it's all really done extremely well. And so, you know, that's not to say that you all will be able to produce things, you know, at the level that the advertising agency here did. But I think that if you think about what's possible from an aspirational side, this is what we want you to do with your materials, right? Like, we want you to figure out from your community's perspective how you would represent this, because this is Detroit. We can't really show this ad in, you know, in the same way. It would look quite different in New York City or in Buffalo, New York, or, you know, in Oklahoma. And so, you know, but you can imagine, you know, thinking about how you might move forward with this. And so I did want to give you an example of something recent that really, I agree with Linda, I thought was incredibly moving. So I'm going to go back to full screen.
This is Emily. I do have a question about that. Was that a ad for something, like a PSA? I didn't see any like branding on it, so I thought at first it was a car commercial, but was kind of unsure. And also, fellow Michigander, so can relate.
So it was produced by an advertising agency of their own volition. So they were not contracted by anybody to do it, but they felt like it was important for them to put out a nod and provide public service announcement basically for free. And they got quite a bit of airtime in the Detroit markets. You know, they made it widely available, and all of the local media, of course, were covering it, and there's quite a bit of attention to it. I would not be shocked if this thing won some industry awards in the next year. So,
Cindy.
Yes.
Cindy. This is Noreen. I'm curious. I liked the presentation, but I'm curious, was it shown before the protests or after the protests?
This came out in early to mid-March. So it was well before the protests that were going on in the state government. Those were much more recent.
Okay. I just wondered because of the do it for love and not for fear. So, yeah.
But again, this thing got more, I mean, the state government is in Lansing, and although they have access to Detroit television, but there was much more of this aired in the Detroit markets. So one of the things that this agency had going for it, which you all have going for it, is, you know, you have been parts of your community for a long time. But I do urge you to realize that, you know, one of the problems sometimes we think is that we know our community or we know how they think about things, when maybe it's a little more complicated or a little different than we realize. And so we have to kind of set our own ideas aside and let folks talk to us about how they see things. But it's important to, as the first steps, and what you'll be doing in your formative evaluation is figuring out, again, on the health side, what kinds of actions are necessary to address the health problem. And if there are particular parts of your audience that are the most vulnerable, or maybe the most ready for change, that in terms of thinking about how you want to break up your markets. So you'll have different potential audience segments. You want to think about, from a communication perspective, again, how you might reach those folks and how they obtain information. I will say, there are lots of old school ways of displaying information that people don't pay much attention to, but, billboards, signs in windows, yard signs, radio, which in a lot of rural communities is still a way in which a lot of people get information, etc. You need to really think again about your resources and how you would allocate them. You want to think if you are trying to chip away at fundamental behaviors or something that's related or ones that are more easily altered. Do you want to look at people who are more resistant? So you want to examine the change process a little bit, and I'll talk about that in a minute. Do you want to go after influencers as opposed to end users? So again, do you want to go after your policymakers, your planners, etc., or more comprehensively look at that side in terms of environmental change in addition to interpersonal level change? And then, are there others that are important to your audience that actually should be targeted? So for example, should you be, if you think your end audience is children, for example, do you want to try to go after the children themselves, or do you want to maybe go after their parents? So where you direct your campaign could be quite different, but the outcome or your end goal might actually still be reached in a more effective way. Thinking about whether or not your awarenesses need to be about just creating basic information or instructional messages or skill-based messages about how to do things, where to go for information, how to sign up for services. Or are you really focused on trying to change attitudes, for example, or beliefs about something? Whatever it is that's sort of, interfering with people performing the outcome that you are most interested in. How many messages do you want? Do you want to focus on promoting healthy alternatives or unhealthy behaviors? And then thinking about the packaging of how you do that. And let me give you an example. So physical activity can be sold as a lack of, which is more unhealthy, or a health promotion aspect. Your audience might think about it or be more motivated by things that are sold to them as a way to spend time with their friends and their community, rather than as something that makes them healthy. But in the end, the behavior of physical activity still might actually get impacted. And then again, thinking about the types of messages, how you roll out those messages, etc. Health campaigns often have very small amounts of change in ultimate behavior, and they can be extremely difficult to evaluate, in part because they are multifaceted. Usually you're trying to do more than one thing at a time. If you have an end product that is very concrete, it can be easier. So I've worked on campaigns about, for example, trying to get people screened for colorectal cancer. If you do something like that, you can work with your health centers to see, was there an uptick in the number of people calling for scheduling appointments, having tests, etc. You might be able to get that also from insurance claim data. But if you're trying to change something that's a little more amorphous or harder to pin down, it can be much more difficult. So I've had community projects where people wanted to focus, for example, on aging in place. And that's a really broad topic. So how do you know that you have impacted that? What's the outcome that would be specific, that would allow you to evaluate that? And And so that's a challenge. If we were going to evaluate that campaign from Detroit, what's the outcome we would expect to see or want to see? And it would potentially be a series of them. How they feel about Detroit, how they feel about the stay-at-home order, their willingness to protect others during that period of time, what percentage of people are violating the stay-at-home orders, et cetera. It could be a whole lot of things. So in this pre-programmed data gathering phase, which you are all about to engage in, you want to think again about both your audience and the health problem. Some of you, probably all of you, have some level of access to existing data, and I want to encourage you to use that. So you might know about the usage of your service. You might have information about your customer base and what it is they're calling about and needing or wanting. You might have access to insurance or health information or appointments. You might be able to look at claims for workers' comp if you're working with organizations. You might have participation data in your services and your programs, and the nature of who's attending your events. And you might have, regularly getting feedback from stakeholders and audiences, either in phone calls or short surveys or focus groups, or just more generally going to meetings, community meetings, and what those agendas had in them, and what the minutes shared with you in terms of, again, how people are thinking about whatever that issue is. So I would say one should always start there, because you do not need to recreate the wheel. But then you're going to find that there's information you don't have or you want more information from. And so you can also think about, community leaders, official and unofficial, and calling them and asking them for input on your idea. I can make some sample templates available to you about what you might ask people. So there are lots of ways to do this. So it does not always mean a survey, for example, or it could, but it could be an environmental scan. It could be a project where people, you look at photographs that have been taken, or what's been covered in your local media, or how you're talked about. It's the sky is the limit. Questions? Ideas?
Hello, sorry, I was muted. I do have a programmed thing. One of the things I know we struggle with as an organization is trying to get that. And our evaluation methods, we've tried surveys and things like that, and sometimes it's hard to get a accurate response and participation.
Mm-hmm.
So I don't know if there was any kind of thoughts about that, or if there was any first-hand experience.
So survey response rates can vary a lot, but over time they have number of people participating, the percent of your population who participate has been diving, because there's a lot of others also asking people to fill that stuff out, not just for social good, but manufacturers. When you're online, you might get a survey because you've ordered something through Amazon or something else. And people are bombarded with information. I think it's particularly bad actually during election years, because people are constantly calling and asking questions about, candidates and social issues and other kinds of things. You know, again, I think it's one of many ways that you can do that. You know, there are other methods that I would suggest, although right now they're harder. So sometimes, you know, just observation, you know, sitting somewhere, talking to people in waiting rooms, you know, observing, you know, in an environment, you know, I'm thinking about behavioral things. You know, the number of people who are smoking in a particular location, or observing where the smoking is occurring, might be another way to think about it. You know, sort of intercept interviews of talking to people in locations where people might be gathering that could give you opinions on something. So where people already are or already congregating for some reasons, are often a good place. So through churches or, you know, parks or shopping areas or, you know, clinic settings, et cetera, might be a good place to kind of under normal circumstances, be able to intercept people for information. You're going to be very limited during this time, so I think you're going to be doing a lot more sort of calling of people, and trying to come up with some targeted lists. It could be a random sample of folks that have used your services to get their opinions. It could be that, again, you look at leaders of other organizations or agencies or workplaces or others who might have a stake in it, and to get some feedback from them and ask for information. I know that's hard. I do believe this is going to be more difficult in this time. Dara, Cindy, Annalena, do you have other suggestions? Or others?
Hi, this is Star.
Yes.
So we've had pretty good success getting our surveys completed from the community, because we do the surveys during major community events, where we know the Native community will come out, because they're our audience, or they're our target population. So, and then how we get them to participate in the surveys, because they're pretty reluctant at first, is we offer incentives. So we've given out water bottles and stress balls, and then we offer like these wellness baskets. So if they participate, they get, or if they turn in a survey, they get a water bottle and a chance to win one of the wellness baskets. And we get a pretty good response rate. You know, because people want to win those prizes, and plus they're prizes that are reinforcing those healthy behaviors that we're trying to target. So, you know, right now we collaborate with Roswell Park Comprehensive Cancer Center, and they're actually gathering. We send out our surveys to them, and they collect the data and they analyze it for us, and then so we've gotten some pretty good information from those surveys. So, you know, I know we can't necessarily do that now, but what I was thinking was, you know, using social media, we could still probably, you know, have a link to that survey, and then still offer some sort of incentive for those who participate. That might work. You know, currently, since we can't meet physically right now, we can't hold those events, but that's something that I was thinking of doing now, you know, in order to get our messages out.
Great ideas. Anybody else? So this sort of in-person thing and event thing, you know, may loosen up over the next few months, and be a better way for you to do that. Some of your employers in your area may be open, in which case, you know, they might be willing to work with you about surveying employees if they're within, you know, the group that you might be interested in. So there may be other ways to think about the face-to-face or the in-person kinds of things. We hope we're in a position like that. Again, if you're a healthcare agency and you're open, you will still be receiving traffic in. But there are many people who are trying to stay away as long as possible. So it creates a selective audience. Anybody else?
Dara suggested in the chat box, social media
Uh-huh.
had a great response from the community using community pages on social media for surveys.
Excellent.
Yeah, we have a Facebook page for both our health department and our hospital, and we do post like the Survey Monkey links for our patient satisfaction survey, but there's also that kind of roadblock of, you know, not everybody in the community has internet or access to social media, so that sometimes can be an obstacle, but just getting people to click on that link and give feedback sometimes, especially when we collect the data, you know, monthly or every so often, it kind of tends to be hard sometimes, but we did have done a in-person incentive large kind of survey at one point, and that was pretty successful, but I can see that kind of being maybe more of the route that we'll have to take. So thank you everybody for that feedback.
There are some good resource guides around that have been developed by foundations and so forth about this, and that can be something that we post to the website. Cindy? I'll say yes, we will do that.
Yes, we'll do that.
Yes. Okay. So when you have that information, one of the things that you're going to be trying to do is figure out who your audience is. And one of the things that you really want to be doing during this process is thinking about where the balance point is between how effective you're going to be and the number of people impacted. If I spend time getting to know each one of you, and I direct my campaign at one of you. I'm going to pick on Dara. So, you know, Dara is my audience segment, and I spend a lot of time with her. I probably will figure out what motivates her and what she's interested in. And if I spend lots of time with her, I will be able to very slowly help her change in terms of whatever it is that's going on. So we know, for example, healthcare providers often have high levels of impact on an individual, but they don't necessarily have that reach of a large number of people. And so one of the things that you're going to do in this process as we help you interpret your data is try to figure out where that balance point is between the practicality of audience and the balance of making sure that, again, we still have some level of efficacy here. People often feel bad about this sort of having to limit or trade off or start with one subgroup at a time. But if you go too broad and there's too much variation in your audience, you have to have a lot more time, resources, and money generally to actually have a larger level of impact. So you'll be playing around with this idea as you go forward. The other thing that the formative evaluation will tell you or help you with is figuring out what your product is. So for some of you, the product is something like getting people to enroll in a service or participate in a program. It might be a tangible good of buying or investing in some physical public health sort of mechanism, like a septic system, a new septic system, or a water filtration system, or other kinds of things to make sure that people have safe drinking water. But it could be that your good is just trying to change attitudes or knowledge or intention. It could be, thinking about driving people again to thinking about you as the service that would be the go-to service for them. So again, you want to give some thought here to what you're selling, and to be sure that what you're selling is what they want to hear. So, and it might require, if you really want to broaden your impact, you might have to go a little bit broader with what you're thinking. So if you're running a substance use treatment facility, the number of people who need substance use treatment is more finite, but the number of people who need prevention services and broader sorts of knowledge and information about substance use to reduce stigma in a community, for example, could very well become an additional goal of your campaign, so that when people need services, they are more likely to come. Does that make sense? I can't see you nodding because I have no visual, so I'm going to envision that you are. And the other thing that would help you during the formative evaluation phase, and I was going to do an activity, but I don't believe that we'll have time, but I'm going to suggest that you do this for your own organization, is thinking about what do you want to impact, but most importantly, what factors actually lead to that problem. And I say that because this is like primary, secondary, and tertiary, prevention versus treatment kind of idea that comes out of public health, which is, do you want to deal with the demand on a treatment facility, or do you want to help figure out what got them into addiction to begin with and try to prevent that? And so, and this will also help you figure out where the problem is and what's actually implementing it. So you might start with what you think your problem is, and then think about why is it happening like that, and then just keep going deeper. So, what caused the problem? One of those things is, number one. Well, why is that? Well, maybe that's cultural history. Maybe it's the lack of resources. Maybe it's a natural disaster that occurred in your area. I mean, you can just keep going deeper, deeper, deeper. Maybe it's a cultural belief system, and so forth. So the question is, where along that pipeline do you attack? Can you attack? And you just want to get to something that you can control, but you want to be as upstream with the problem as you possibly can, rather than really flood your system with more need. Questions? And then public health folks, this is probably an idea that is known to most of you, but effective campaigns are just like a lot of other public health programs. We want to have SMART goals, right? Like, so we want our goal for the program to be as specific, measurable, assignable, realistic, and time specified as possible. Part of this time has been specified for you. We know we'll be doing a lot of these activities over the next 6 months. But we also have to think about what's realistic during that timeline, what's realistic for you following that timeline, who is available in your organization, what you can realistically do to show change. I think it is very important for communities to have wins. So try not to have such lofty goals that you're constantly disappointed, but to chunk things up into things that are very specific and attainable so that you can make progress. Most public health things are not short-term. They are very long-term in thinking about them, or they require repeating. And people get burned out very quickly from things, as you all know, if they don't feel like they were victorious in some way in whatever their effort was. So we want you to feel good about whatever you've done, and we want your community to feel good about it. So another tool, and I've got some information I can provide you about this, is to think about logic models. And there are two types of these. There are ones that are sort of more practice-based, which your grant writers among you know very well because a lot of agencies ask for them. But you can also think of them in terms of what you expect to change and why. So they're a blueprint, basically, for your project. It's thinking about your inputs and what resources you have available and what it is you want to obtain, of the activities you might do to actually have the outcome you want. But you might also think about, again, what you want to change and why, and what's obtainable in the short, medium, or long term as you move forward. It's basically a checks and balances about thinking about your own logic. It's a very quick way to communicate to yourself, your team, others, the community, what it is you're working on. And again, there are different types of these. So this is a really traditional one. This is one I personally had to write for a grant project. So project funded by the National Institute of Occupational Safety and Health, and we were interested in protecting young agricultural workers across the nation, and we were directing our project at supervisors and supervisor training. And the agency asked us to lay out what we thought what resources we had available, what the activities were we thought would actually be helpful, what our outputs of those would be, how we would transfer the information, so thinking about dissemination and so forth. And then what do we think the intermediate and long-term outcomes of our project might be. So this is, again, a framework of one way in which to think about it. And there are lots of different examples of logic models that are available through CDC, Robert Wood Johnson Foundation, Kellogg Foundation, and others have some freely available resources about how to do these. So how many of you have used these logic models in some way? I can't see you.
So I have used something similar for substance abuse prevention and planning.
Yeah. Yeah, they come up in all kinds of fields. But it does sort of help you concretely lay out what you have, particularly if you think about your inputs. So that, again, you're realistic with the activities that you're designing to make sure that they fit within your budget. And that, they're designed to have the outcomes that you want. All right, move on. Okay. So theory, which, often scares my students, is, a way in which to analyze a problem, to define objectives, to think about evaluation, because it tells you what things you would expect to change and why. and they can be very useful in pointing to the different facets interventions need to have in order to be able to produce change. Theories are good for different kinds of, there are lots of theories, and people sometimes think there are too many theories. But I would say that theories are like other kinds of tools. There is not a one size fits all. Some problems lend themselves to certain kinds of theories and some to others. I'm going to give you some, examples of theories that I think could be helpful. But as I know more about your problems, I probably will be able to help you define better which ones might help you think about your situation in a more constructive way. And I'm going to give some examples about that. So I'm skipping a slide. I may or may not go back to it, but it's basically a logic model based on a theory for the same project that's an alternative to the one I just did with inputs and so forth. So many of you might be familiar in some way with the social cognitive theory, which is used in a lot of health promotion work for those of you that are involved. And it basically means that, any kind of outcome is related to thinking about characteristics of the individual, whether that's genetics or attitudes, thinking about behaviors, but also thinking about the environment in which somebody's embedded. And so basically you need to be kind of thinking about all three of these things at once in terms of how they impact the outcomes that you want. So that we make sure that, again, we're directing the campaign in the right direction. So, I might have every intention in the world, for example, of getting physical activity. So my own personal beliefs might be in favor of that. I'm a relatively fit person and so forth. I already have a certain set of behavioral practices about physical activity, which, I walk to work normally, for example, although I have not been doing a lot of that of late, although I've been trying to get, walks into my day to help. But I'm also impacted by the environment. So again, because, COVID shut down my workplace, and will be beginning to reopen in the next little bit, the change in environment has changed my physical activity level. So my meetings are now in a seated position. I no longer walk between buildings to have meetings. I don't walk to work anymore. So like the environment changed despite my good feelings about doing that and my previous behavior. So if I was going to design a campaign for physical activity around COVID, it would be teaching people, for example, how they might think about their environment and their opportunities and their choices a little bit differently for, fitting walks in at other parts of your day if you live in an environment where the weather and the safety issues allow for that. It might be what you can do within the place you live, using food cans as a weight, for example, rather than thinking that you need to go to the gym and actually have, weights to lift, but finding things around your home that you might be able to do with that. Figuring out how to practice yoga in your living room or whatever the thing is. But the environment alone, even if it's been stable and accommodating, could change. Communities have natural disasters. The physical environment can change because, again, weather. Some of us live in very extreme climates that can impact people. The other aspects of this are the idea that we learn from others, we watch others directly and indirectly, and we follow what happens to them and their stories and their outcomes. And based on that, we either, we mimic the behavior or can be motivated to learn. we have our own expectations for whether or not the behavior will result in a good or a bad outcome. And we often need to reinforce behavior and ideas in order to make them stick. So this is a very, very common theory in public health, and actually the originator of this was at the University of Iowa. Again, I think useful. So, you know, again, what I'm trying to teach you is to think about the constructs of things that you might want to pay attention to given your individual circumstance. Theory of planned behavior, which originated by Fishbein and Eisen as a theory of reasoned action. So you may have heard of it either way. But it's basically saying that attitudes toward the behavior, how other people in your lives that are important to you feel about something, and whether or not you believe you have the ability to do that will impact your intention to perform the behavior and then your actual behavior. This one is also used a lot in things like healthy eating campaigns, because we know eating tends to be an activity that's done in families, it's done in small communities among groups of friends, and so that normative environment can be very influential in those cases. And so we might be trying to focus on changing the norm as opposed to the individual behavior, for example, so that we try to move the whole group together. We might try to change the actual behavior or the perceived ability to perform a behavior. So I might not believe that I can get fresh groceries or fresh foods. That may be a perception. It might actually be, they may actually be available, or I might live in a food desert where it's a lot harder to actually do that. But either way, that might be something you absolutely need to address, because if it's not available, then it's not a reasonable outcome to expect that people are going to change their eating behavior in those contexts. All right. Questions on either of those? I will take that as a no. Okay. All right, quick stretch. This is, okay. This is another public health model called the health belief model. And it talks about a number of different factors that might impact people's likelihood of action. So this is a combination of perceived susceptibility. So do I believe the bad thing is going to happen to me? And particularly adolescents and young adults are very bad at believing anything is going to happen to them. And so this is a huge problem in that particular age group. But it can happen with a lot of people throughout their lives. Women are more likely to feel vulnerable to things than men are in many cases. So it can also be a gender effect. The actual threat of a disease, the severity of the disease, can impact behavior. We might also think about the benefits of whatever it is you're proposing that I do, and the barriers to that change, as well as whether or not the threat will avert the bad outcome. We are influenced also by, again, age, sex, ethnicity, personality, knowledge, as well as cues to action. So, we might have all the intentions in the world of washing our hands on a regular basis during COVID or using hand sanitizer, But for example, I'm much more likely to be using it on a regular basis because it's sitting right here next to my desk. I'm going to model good behavior and do it right now, since my keyboard is probably dirty. Questions about that? Again, the specifics of this do not matter. It's sort of the ideas of things that you might want to pay attention to. Okay. All right. Lots of substance use treatment people in the room. So what do people, somebody in the room know something about stages of change? I'm going to make somebody else talk. Maybe not. Dara, I'm going to pick on you. You out there?
I think so. Can you see me?
Yes. I'm picking on you.
Well,
It might be a bad thing to do to you. I'm sorry about that. But you know, it's very hard to sit and hear your own voice.
Stages of change, just from what I can remember of it, I suppose, is people are in different stages of readiness. So you have your pre-contemplation, your contemplation, and depending on what stage they're in, you have to target certain behaviors or elicit certain behaviors from them to try to get them either to the next stage or, yeah, I guess that's probably really the point, is to try to push them towards the next stage.
So there are people that are not even thinking about what it is that maybe you want them to do, right? Those are people in pre-contemplators. So I give them a whole bunch of information about, you know, you need to go get treatment, for example. That message is not going to be very well received. Instead, you really want to start working on just creating some level of awareness and level of interest in that individual, hoping that as you move them into more and more ready situations, that they'll eventually be ready for things like skill development, resources, etc. But they're not necessarily ready out of the gate. So you can do this not just on an individual level, but you can think about it more on a community level too. So, you know, what do they know about your services? Are they interested in your services? You know, and then again, tailoring the information based on the readiness of where they are. If they don't know about you, that's very different than if they have negative attitudes toward you. All right. Okay, I'm going to go down. Let's try another one. Okay. So I'm going to talk about the extended parallel process model, which is basically a combination of thinking about threat and efficacy. So this is a communication model actually originally, and basically it says that any information that you provide should address 4 things. That people are susceptible for the risk. You want to help them feel susceptible. You want them to feel that whatever they're at risk for is harmful, which is severity, similar to the health belief model. You want people to feel like they can actually do the thing that you're recommending, which is self-efficacy, and that whatever thing you're recommending is going to avert the threat or minimize it in some way, which is a response efficacy. So if you develop messages that are both high in threat and efficacy, people are more likely to take actions that you are recommending. If they feel, if they have a high sense of threat and a very low sense of efficacy, what happens is people sort of become paralyzed in their fear and don't feel like there's anything they can do about it. So people can start to become in denial because it's, you know, protective for them at that point. You know, things that are low threat, people might just not even pay attention to. So again, you're trying to create both senses of threat and efficacy. And I lost where I was on this. Here we go. All right. I think this is a great theory for thinking about the information you actually put in your messages. It might tell you a little less about where that needs to be directed. So again, if you've got an environmental problem, you might need to direct it at solving that first, so that then individuals can do what it is that you are recommending. So, you know, again, access to fresh food, clean water, etc., would be your first line of attack, not necessarily spending a lot of time designing messages that tell you that, you know, you should be eating fresh fruit and vegetables and why. Questions? So there are lots of theories, a number of which basically use those 4 variables. They're called different things in different theories, but those 4 ideas about severity, susceptibility, self-efficacy, and response efficacy are in a whole lot of behavioral models. So those are 4 ideas I think you should pay an awful lot of attention to. So again, convincing people that that thing is harmful, that, you know, they're in danger of getting it themselves or being impacted in some way, that there's something that they can do about it that will avert that harm, and that they have the power to enact whatever that action is. Again, figuring out if one of those things is not there, how you actually solve that problem. People in public health are very good about selling severity and susceptibility. They tell you how terrible diseases are. They show pictures of, you know, smokers who terrible things have happened to. But they're not necessarily always as good at convincing you, for example, that the treatment will avert the threat, or that the screening will help you, or that eating those fresh fruit and vegetables will keep you from cancer. Part of it is, you know, often those threats are long-term and not immediate, and so people have a harder time sort of seeing the causal pathway and believing that, you know, what I do at age 16 is really going to have a negative impact for me at age, you know, 50. Or 50 feels so far away that I don't feel susceptible at all. There'll be some cure for that thing before I get to that age. All right. Everything that you are selling in terms of your solutions is going to, you'll need to think about what the attributes of that thing are. So, is what you're suggesting better than what's available now or what it will replace? Is it something that your community finds culturally or personally or in their family situation compatible with their daily lives? How complex is that thing? Can I try it before I have to adopt it? There are some things that you can easily try. It's, you know, often we have food samples in grocery stores, for example, and which allow us to try a product before we buy them. We don't necessarily allow people to try, you know, a blood test, right? I mean, I guess you can try one and then you have another one in the future. but it's not quite the same level of ask. You get to try a car before you buy it, typically. But we don't always think about, do you get to try a health service or an agency or a product or treatment before you have to sign on, for example, for a 10-week program, which might be a large ask. And can you see the results? Are they observable and measurable? So will that help the person realize that they averted the threat or somebody else averted the threat because I can actually see somebody performing it, or, I can see the weight loss, for example, in the mirror. That's a more observable activity. Blood sugar levels and so forth are not as observable for most individuals. There are people who are willing to do things early in a process. They'll take a new thing and sign up right away, or try something, or try a new technology, or try a new service. And then there are people that will take, they'll be the very last people to do things. Some of this is personality, but some of it is the nature of what the innovation is. So I might be really innovative and an early adopter with some things, but I might be more conservative with others. So I might be more likely to try a new food, but less likely, for example, to buy a new computer or try a new service. And again, often it's because of the attributes of the ask. And I don't like to spend money. I'm extremely cheap. So that's something else about me. All right. Let me give you one more and then I'm going to stop. So another way that psychologists often think about delivering information is that there are some people who really like to think about things. They have the ability to think about them and they're motivated to do so. Again, this can be personality based, but it can also be situational. So I might be more motivated about some health topics than others, for example. I might be very smart about, about science, but don't know anything about art. That might impact my ability to process things. Or I could be somebody who I don't have a lot of ability and or motivation. And the way in which you deliver information to those two groups can look quite different. So if I want to tackle somebody who has less ability and motivation to provide information, I'm not going to give them like a 4-page brochure or handout or a very complicated website. I might give them an infographic. I might give them a picture. I might give them a poster, but that isn't a large ask of the person to get them to pay attention. But there are some people who really do want and need detailed information, and they're going to be more likely to process it that way. And if you have a lot of people in that stage, then you're going to need to give a lot more detailed information about your services, agencies, products, etc., and not quite as in a little bit more complicated way. If people process centrally, their attitudes and behaviors tend to be more stable and long-term. If they peripherally process, they're going to be less stable, and it's going to be more short-term for them. The nature of what your product is could dictate some things here too. So if I work in a facility where they have a flu vaccine available in the lobby to me once per year, I don't actually need to be thinking about that for a whole year. I only need to be thinking about it the day that's available. And, maybe the act of, making it freely available and convenient right there will cause people to make the change. But if I want long-term change and maintenance of that behavior, like physical activity or healthy eating, the peripheral processing thing becomes a lot more dangerous. So again, figuring out how your audience thinks about things and how they take in information and what the environment is like in terms of how they're processing could matter a lot in how you might want to deliver. This is an idea we'll come back to when we get to the more communication design part of it. I have thrown a ton of stuff at you, and I have more that I didn't get to. But I want to spend the remaining 10 minutes just for question and answer. And again, I'll make more information available to you. As I know more, again, about your audience and your topic, I can really help you fine tune what it is that you're doing. I'm going to move back out here.